Hello everyone, today we will be studying about the definition of the relapse and the causes of the relapse. So let's begin. Relapse has been defined as the loss of any correction that is achieved by the orthodontic treatment. There are different causes of the relapse. So let's begin with the different causes. The first is the unstable occlusion. Second is the muscle imbalance. Third is persistent etiology. Fourth is continued growth. Fifth is erupting third molars, and sixth is stretched fibers. So let's begin and study it in detail. The first is the periodontal ligament traction. Whenever teeth are moved orthodontically, the periodontal principal fibers and the gingival fibers that encircles the teeth are stretched. These stretched fibers can contract and are thus a potent cause of the relapse. The studies have shown that the principal fiber reorganize in about 4 weeks of the time, whereas the supraalveolar gingival fibers on the other hand takes about 40 weeks to rearrange around the new position and thus predispose to the relapse. After the comprehensive orthodontic treatment, teeth require 4 to 5 months of the full-time retention so as to allow the reorganization of the periodontal ligament fibers. After this period, retention should be continued on a reduced basis for further 7 to 8 months so as to allow the more sluggish gingival fibers to readapt to the new tooth position. Now the second cause is relapse due to the growth-related changes. Patient with the skeletal problem associated with the class 2, class 3, open bite or the deep bite malocclusion may exhibit relapse due to continuation of the abnormal growth pattern after the orthodontic therapy. Studies have shown that the original growth pattern resurfaces or dominates if the orthodontic treatment is complete prior to the completion of the growth. Hence, the prolonged retention is indicated until active growth is completed. Now, third, bone adaptation. The teeth that have been moved recently are surrounded by lightly calcified osteoid bone. Thus, the teeth are not adequately stabilized and have the tendency to move to their original position. The bony trabeculi are normally arranged perpendicular to the long axis of the teeth. However, during the orthodontic treatment, they may get aligned parallel to the direction of the force. During the retention phase, they revert back their normal arrangement. Muscular forces. The teeth are encapsulated in all directions by blanket of muscles. Muscle imbalance at the end of the orthodontic therapy can result in the reappearance of the malocclusion. The orthodontist should aim in harmonizing the muscles at the conclusion of the orthodontic treatment so as to increase the stability of the treatment results achieved. Next is failure to eliminate the original cause. The failure to remove the etiology can result in relapse. Now the role of the third molars. The third molars erupt very late in the development of the dentition. They erupt in most cases between the ages of 18 to 21 years. By this time, most of the patient would have completed the orthodontic treatment. The pressure exerted by the erupting third molars is believed to cause the late anterior crowding, predisposing to relapse. Now next is role of the occlusion. Good intercuspation of the upper and the lower teeth is very important factor in maintaining the stability of the treated cases. The centric relation and the centric occlusion should coincide, or the slide from the centric should not be more than 1.5 to 2 mm in order to have a greater stability of the treatment results. Presence of certain occlusal mannerisms such as clenching, grinding, nail biting, lip biting, etc. are the important cause of the relapse. So